I don't think any of us are that surprised by what we see in this study. You know, I was born and raised in the San Joaquin Valley. I was born in Delano, in the middle of the farm workers movement. And I moved to Fresno when I was 6, and I grew up off of Belmont and San Pablo. I like to say it was the wrong side of the tracks, you know, but that was my home. I grew up in 93728, which, if you look across the state, is one of the top 25 worst economic and environmental zip codes that we have in our state. And that same zip code that I grew up in is the same zip code that I live now and that I'm raising my kids right now, my 3 daughters. And so when I'm looking at this study, what I'm looking at is what's going to happen to change the outcomes for my kids. Because what I cannot accept is the healthcare delivery system that we have today. Because it is broken and it's not working for communities like ours. It's creating a social injustice where people who are from the wrong side of the tracks, we don't get to live as long as those who come from the right side. And there's something that's happening. We have a tremendous amount of poverty, and I think there's something to the opposite of poverty. I call it health. Because when you don't have funds, you can't afford the care that you're getting, you're not getting the health care that you deserve. Now, I believe that health care is a human right, and I'm proud to say that I practiced my entire life in an emergency room. Where you came to me, I didn't ask what was in your wallet or where your passport said you were from. I took care of you because you asked for my help. Because you came here today to say that I don't have anywhere else to turn. But here's the sad reality that's happening in our community. I worked in Selma, which is the raisin capital of the world, where I took care of farm workers because that's where I grew up. And I was going to dedicate my life to come back to help people. But in the last decade that I was working, I was asked to see 3 times the amount of patients. Because while we're increasing the number of people who are insured, we're not increasing the access to care, and we're not changing the outcomes in our communities. And so I want to answer the mayor's question when he answered it earlier. What are you willing to do? I'm willing to leave my job. I'm willing to go and run for office. I'm willing to come here and to fight. And I'm proud to say that right now I am the chair of the Budget Subcommittee on Health and Human Services. Every dollar that the state spends in health care and welfare comes through my committee. I now have an opportunity to have oversight and to say that communities like mine, communities from the Central Valley, are getting left behind, and that we need to stand up and demand better, that we should expect more. Now, sometimes in this political climate, I can't breathe, you know, and it's just not the poor air quality we have. It's the fact that I feel like the oxygen gets sucked from the room because all we can talk about is things that take 140 characters to say. You know, and I want to actually talk about real substantive policy. I spent my life as a doctor taking care of people, and what I'm seeing are a bunch of politicians who haven't spent a day of their life practicing medicine. I saw 50,000 patients, and I hear their stories every time I'm up here, and I'm hearing the bureaucrats not wanting to actually fix the problems. So I need you to know that you have a champion for a cause up here, not some chump in a chair. You know, I want to stand up for our community because I think we should demand more. You know, in Fresno, I graduated from Edison, which is, you know, some of the highest areas of concentrated poverty in our country. They call us the Appalachia of the West, and what I have seen is a generation of poverty. Now, I haven't seen any changes. I haven't seen any fixes. Now, I'm up here to make sure that we're fighting for health care as a human right. I believe that every human in California deserves to have access to care, and that we need to make our systems more efficient to be able to provide better and more comprehensive health care. That's what I work for and what I dedicate my life for. But I'll tell you, it's not without personal sacrifice. And, you know, it's not always that easy to leave the comforts of what you've prepared your whole life to do. But I wouldn't be here today if it wasn't for someone who believed in me and dreamed that we could do what we're doing. And so with your help, I just want to ask for one favor, please. My wife is in the back of the room. And I would not have been allowed to have run for office if she would not have believed that we could do something. But she married a doctor, not an aspiring assemblyman. But she saw the same fire in me that I think many of you see right now. And she knew that she couldn't stand in that way, that she had to help me, because we both know that our community is struggling and that we need people to stand up and to fight for us. So thank you guys for taking your time to come here to Sacramento. It's been an honor to address you.